All right, welcome to Third Coast Grappling Radio. I told Ryan to wait 5 seconds, so he thought that meant 5 minutes. So
the little box on this little chat thing is super small, and I can just see Zach's head, Corey's head, and then that's it. So
we'll get this remote stuff down one day. So my dad called me today, and he's like, "Hey, I have a Skype meeting tomorrow. Can you help me figure this out so I don't look like an idiot tomorrow?" So I literally had to walk my dad through how to do a Skype meeting, and I was like, "Don't worry, no matter what, something's not gonna work. Somebody's, camera's not gonna work, or somebody's audio's not working. You're gonna be like, you're on mute. Can you hear me now?" So happens every day, even before coronavirus. This is not.
Maybe you should have invited me into that remedial class with your dad, and we could have avoided this whole mess. So, I don't know.
Yeah, we probably didn't need that help.
I'm your other host, Ryan. We've got a special guest in the house. She's a good friend of ours, but also a good friend of the event. And she's, they were pretty crucial in the beginning when we were building up Third Coast, giving us some good advice and support, her and her husband both. So, just so happens that she is.
She might have paid out quite a bit of our athletes before too.
Yeah, I mean, two of the earlier 3CGs, a nice long-haired, dark-haired lady. She's kind of mean, kind of a jerk, but she has a heart of gold, so she makes up good. But she's a good friend of ours. She's a PhD student, Corri Levine, and she's studying infectious disease and public health with a focus on emerging infections and to the public health importance. So she's been somebody that we've really kind of leaned on for advice, as well as local and federal government. But yeah, it's great to have somebody that close to us. Corri, nice to have you on tonight.
Yeah,
thanks for having me.
Have you been keeping your social distancing?
Oh yeah, we are locked in the house and only going out for mail at this point.
Yeah, do you make sure to wipe your hands after you touch the mail?
Yeah, so we actually have a little system set up. We had a clean, dirty magnet for our dishwasher, and we instead put that on the table, just on one corner where we put anything that comes into the house that's dirty, and that little magnet gets flipped, and then as soon as all that stuff goes away, we wipe it off and it's clean again.
Sure, that's a better system than a lot of other people.
Yeah,
I think Zach's kind of taken the play, because he's got a baby about to be born, so he's just been full on lockdown, doomsday prepper style. Where here, me, I don't like to be told I can't do something, so I'm trying to find ways to, can we throw events still? Can we do this? Can I go play basketball? And as soon as Corri will see something that I'm posting or trying to get going, I get a text message, and I'm like, all right, she's on to something here. So it's been, I don't know, it's been interesting, but I think we're all getting kind of adjusted to our new way of life as this thing works out.
True.
So what's new? What's new, Corri? What's going on with in the coronavirus? Give us the latest.
fine. So looks like we're going to be close to 500,000 confirmed cases across the globe. But on the upside, over 100,000 of them are recovered. So that's good. Here in Texas, State and Health Services made up a really nice dashboard. And so they're keeping track of everything there. I'm thinking we're going to top 1,000 cases tomorrow. We're at 974 right now. But a lot of that has come from increased testing. There's a couple clinics or pop-up clinics in downtown Houston right now where you can call, or you can go online and fill out a screening form, and they'll give you a number and you can come in. So expect the case count to keep going up, and that's going to be mainly due to increased testing. So don't be so shocked.
So on the increased testing stuff, so I guess I've been doing some research myself, and it looks like unless you're symptomatic or you're above a certain age, they're not going to test you, correct?
Right. So it really depends on where you are and how many tests they have available. Right now, it seems like, from my knowledge, we can't detect cases until you're symptomatic. So there's no point in calling if you're just like, oh, I want to go get tested just because. There's no point. You're not going to get tested. And even if you did, they're likely not going to be able to detect anything. The other thing that goes with it is how many tests they have available. So you really want to target it to your highest risk groups. So that's your elderly, your immune compromised, your healthcare workers that are, face to face with infected patients.
Yeah, that's pretty interesting. So when they're trying to do this, I guess social distancing, people are staying home for 2 weeks. I guess that's because people could be asymptomatic, not showing any symptoms, or they could be, not in an at-risk, I guess, demographic, to where if you stay home, you're not showing any symptoms, it's probably better to go out. But if in that 14 days you are showing symptoms and you're younger, maybe you can just, self-quarantine and not go out. Is that kind of just to offset the possible overload of the hospitals, or how is that set?
Yeah, definitely. So I've actually been switching to using the term physical distancing rather than social distancing. We all want to be social. You and I, we're all being social right now, but it's the physical distancing that we want to deal with. And so this is where people are trying to stay. We're trying to keep people indoors, out of public spaces.
I was using that excuse not to call my mom, so no, sure.
Yeah. Call your mom.
Yeah.
Tell her to not go inside.
Sorry, social distancing. I'm not allowed to socialize.
You've probably heard the 6 foot rule. Try to stay 6 feet away from people. The way I really like to think about it is who's in your normal airspace. So who do you share air with on a daily basis? For me, it's Ben, and that's it. On a normal day, that's the only person I'm sharing air with, so that's the only person I'm trying to be in contact with right now.
And your pets.
Well, Corri,
and the pets.
You do have some bird pets, some bird family that I do believe breathe the same oxygen and we do, so I would not leave them out of this equation.
Okay, well, the likelihood of them getting sick is pretty low, so I'm not counting them in the corona sphere.
Oh man, good luck. Good for them.
So how is this different, do you think, than the H1N1 in 2009? Was there already a vaccine in 2009 because of H1N1 wasn't new?
So there was not a vaccine for H1N1 at the time, but they were able to develop one pretty quickly. And that's because of there's a flu vaccine every year. And so we already kind of have that platform ready to go that'll work with influenza. And so it was easy to shift production to that specific strain and get those vaccines out. The hard part for this is we don't have any platform that has been proven for coronaviruses. Right. And so we're kind of just starting from the beginning.
That's pretty crazy. So with the coronavirus and the spread and everything, I mean, you've heard the president, what he's been saying lately about possibly wanting to open the country, possibly by Easter and all this other stuff. What do you think about that? Like, is that realistic, or is that him just trying to breathe in some optimism into, to our country and give people a little bit of help or hope?
So I'm going to try to be apolitical. I think it's trying to give hope, but I don't see it as being a possibility. We really do need a longer period of time in order for this to have any sort of effect. There's the 15 days to slow the spread, and this is to what you alluded to before, that whole asymptomatic or pre-symptomatic period where someone could be carrying it, but they're not yet spreading it. And so, that's where the 15 days come from. If everybody got infected on day 1, then by day 14 of this, everybody should be symptomatic.
Yeah.
But you now have 2 weeks after they're symptomatic that they're still spreading the virus or potentially spreading it. And so you would want another 2 weeks after that and maybe another after that just to get rid of it all.
I feel like the mortality rates are a little off because it shouldn't necessarily be how many people have died compared to how many cases there are. It should almost be like how many people have died compared to how many cases there were 2 weeks ago. Since it takes so long for it to actually, become symptomatic, it shouldn't end, and because you don't get tested until you're symptomatic. So it should really be like how many people have died compared to how many known cases there were 2 weeks ago. Does that make sense? Or
Yeah, so that's exactly the problem. And so everybody's trying to throw out case fatality rates, how many, what percentage of people are dying. But in reality, we can't calculate this number until we know how many people were infected.
yeah.
And so right now, we're testing people who are symptomatic and who are, in a lot of cases, sick enough to show up to the hospital.
Right. Because there
And
could
so
be
the
people
number
that
you're
sick
seeing
that
is-
self-quarantine and they never get even... And it's not even the official numbers until it goes to the CDC, right? That's what the presumptive cases are, is like they could test positive, but that's not going towards the number of confirmed cases until those numbers get calculated at the CDC.
Yeah, so it all depends on where you're looking at your information. So the CDC said early on that once testing gets spread out around the country, that every state is going to have to keep track of their own counts. That being said, CDC is still counting, but the numbers might vary depending on when they report, how many tests they've run, all of that.
Now, with all the testing stuff, because I've talked to you about this offline, like you're saying that missing link of data is the amount of actual infected, which as a country, we're seeing, 400,000 cases and 500 deaths. How many people are actually in America right now? And how many people are walking around with coronavirus, not being able to be tested, potentially won't be tested because they're not sick enough to want to have to go see urgent care? Like, this is a big problem, and that's why I was listening to Dr. Fauci before we did this, and he was saying that basically this could end up being like a seasonal influenza because we're seeing like down in Africa, they're going into winter and it's kind of coming back a little bit. Like, I mean, this may just be something that's part of our daily lives from now on.
Yeah, it's entirely a possibility. There are just so many unknowns right now that, I don't think anybody can give a good answer, but it's something that we do need to think about.
Yeah, it's like blowing my mind. Like, we're doing all these testing. Like, Texas is like, we tested 7,000 people today. I'm like, do you know how many people live in Texas? like just in like these hotspot areas like Dallas.
Well, how many people actually knew how many people died from the influenza every year? I think that has surprised a lot of people. I don't think
50,000.
I don't see a purpose in comparing, well, these many people die from heart attacks each year and this and that, because most of those statistics are not exponential, right? Like, how many people die every day in a car wreck? That might be 400. That might be more people than have died today in the U.S. or so far in the U.S. from coronavirus. But people dying in cars is not exponential. So it's not like if the automobiles company said, hey, cars are failing at an exponential rate. We don't know which cars it is right now. But the longer you are on the road, the more likely your car will fail and you will die. People would stop driving, right? People would get off the road and stop driving. It's not like, 300 people die in the car every day, so I'm not going to drive. You got to compare it to how many people actually drive and what that actual rate of risk is, right? So since we don't know, since the unknown is still there, that's why, we need to tighten everything down until we can get actual numbers and see what the real, unless we actually believe the numbers coming out of China.
Which we don't.
Yeah, I mean, I think somebody asked that question, and mentioned, do we believe the numbers out of China? And I think, again, it's hard. They still have cases, and they still have people who are trying to put all this data together, and so everything is just a snapshot in time right now.
Yeah, they still haven't gone back to school either.
Is importing in like new cases now. So it's like, we're easing our restrictions. Everybody come home. We're doing great. But now they're bringing in basically the rest of the infected world back to China.
Well, I read today too, Spain has surpassed China's numbers with infected cases. So
that's crazy. In Italy, like, I was going to ask you about this before we get to a lot of the people that were really interested in this podcast or questions. But what is the difference between Italy and America? I mean, I could guess, like, look, they have an older population. Majority of the people dying are 80 plus. But why so bad there? And is that really a possibility for us here in the U.S., the number one superpower in the world? Like, is that a possibility for Italy to come to America?
With that attitude, yes, that because we're the superpower, it can't happen to us.
No, I'm not saying it can't happen. I'm just saying, like, we have all these advances in modern medicine. We have a lot of things that maybe in Italy is more of a, you know, an older country out. You know, it's just, you know what I mean? Yeah, I mean, just as a country, can that sort
We're more obese than them. We have probably more diabetics. Like there's.
Yeah, I mean that's true, but they're also.
Let's let the expert talk. Sorry.
Yeah, so I don't know off the top of my head kind of the demographic breakdown between Italy and the US, but like Zach said, we do have a lot of people here with underlying conditions. So diabetes, you know, obesity leads to a lot of
definitely
things.
not as healthy
Heart
as people
disease,
in
lung disease.
I feel attacked. I'm just kidding.
Eating all your quarantine snacks, huh?
Yeah, so it's definitely a possibility. If you look at New York City right now, it's kind of scary. The same situation that's been happening in Italy is happening in New York right now.
And that's what I was wanting to touch on. Like New York is like they're saying could be the epicenter, and you and your husband both come from that area, so if you have a lot of friends and family that are possibly that are going to be affected by this, and that's what I'm saying. Like, are we advanced enough as a country to where we can avoid the massive loss of life that they're seeing in Italy? Just mainly due to maybe not being as advanced in the country, socialized medicine, you know, people being older, not really having much access to care. Like that's what I'm trying to see. Can we see the catastrophic loss of life here in the U.S. that they're seeing there?
So if we don't try to reduce the number of infected individuals and try to reduce the strain on the healthcare system, then yes, I think it's a very real possibility. I was reading a report earlier today that showed within 4 weeks of China's movement bans for Wuhan, the number of ICU beds that were needed were at the capacity of what the US has.
Wow. That's crazy. So I mean, that basically, like they've been saying all along, that the biggest strain to us is going to be the hospitals not being able to take care of the people who need to take care of.
Yeah, and so you also have to think one step further from that. So we're talking about this capacity to take care of coronavirus patients, people who need ventilators, people who need that care. But what about somebody who's in a car wreck?
Yeah.
Yeah, you're right.
You need emergency care too. What about that person who has heart disease? Yep, they have a heart attack. What do you do about that?
The issue is like overwhelming demand and reduced supply, right? It's the normal rates of injuries and sicknesses they haven't declined really at all, at least to the extent that it's going to offset the demand of the coronavirus patients. So the demand has surpassed supply. And that's one of the big issues, and that's what makes it complicated, is that the healthcare worker teams, they're going to get sick too, and then they're going to be quarantined, which reduces the supply of workers, not only the supply of ventilators, supply of beds, but the workforce as well. So then you have all the elective surgery, people like plastic surgery nurses and RNs and surgeons have to go over to work on the CV patients because that supply is down and the demand is just continuing to increase. I guess there are probably less car wrecks right now.
I was thinking that too.
Less risky behavior like people bungee jumping and stuff, but still, people can get hurt in their house doing more home projects. Domestic abuse could probably increase. Like there's a lot of stuff that can still cause people to have to go to the hospital.
Yeah, like one of the things like really close to my heart is like I've been reading a lot about like child abuse and stuff like that. Like there's kids, there's stories coming out that kids getting killed and stuff like that because school and getting away each day was like their saving grace from their parents. So there's these poor kids that are just getting abused and beaten down. They're dying. It's all because they're being kept around that level of toxicity of a parent when normally they at least had that 8 hours a day, to get away from them. And that's heartbreaking to see that type of stuff come out.
Yeah.
So it's I don't know this. There's a lot more ramifications to this, and I think that might be why the president's like, hey, I want to try and get this back sooner. I don't want to shut off the country now, blah, 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 blah. But, yeah, it's tough situation.
Well,
so,
and what I think what makes a lot of people it harder for is it's hard to find people with firsthand accounts of people that have gotten sick too. You always, like, if you do hear it's like a friend of a friend, or I know somebody that knows somebody, and it's very hard to really find even people that have gotten through it. And I think that's what it's making it tough right now too, is people are like, you know, not really seeing it and not being able to see it unless you are in the hospitals, because you're at home and all you're doing is watching, you know, looking at memes on Instagram all day. You're not seeing what's in the actual hospitals because you're not going to the hospitals, right?
Yeah. I mean, this might be kind of a little bit, but you know, my wife Lisa, she's been sick probably for the past few days, and she has really bad asthma. And so, I guess last night she started kind of having an asthma attack, and she couldn't breathe. She didn't have her alveoli, and she'd been sick. She'd already had like the crackling in her lungs. And so she started having an asthma attack really bad, and it like triggered a panic attack almost. And so it sent her into like this crazy ordeal to where, you know, I was trying to help her, but she literally, like, her heart rate was like in the 200s. Like, it was crazy. Like, it was probably the scariest thing I've had to deal with. But I ended up having to take her to the emergency room at like 10 o'clock at night. And they came out in like their biohazard suits and, you know, questioned her like, hey, have you had a fever and this? And she's like, yeah, it's all that. She did have this. So, you know, they took her away, wouldn't even let us go with her. Like, we weren't even able to go with her. And I had my daughter with me because if Lisa has a coronavirus, where can I take myself and my daughter? Not to her mom who has lupus, not to some other family members. Me and Mason literally sat in the car at the Methodist hospital for like 3 or 4 hours while Lisa got screamed out. And they just said that it was basically a severe asthma attack, and panic attack kind of brought on that with everything that was going on. But just the experience alone, she had to like get isolated in like a bubble and like all this weird stuff, and the test where they like jam it through the back of your nose. It was unreal just having it hit that close to home. So I think we're gonna. I mean, like Zach said, there's a lot of like stories from my friend went through this and that, but I think there's going to be a lot more maybe in the next week or so. You know, unfortunately, that we're going to have more stories like this.
All right, so should we get into the Q&A questions from Facebook?
Yeah, I've got them lined up right now. I guess we can start off with number one, which is, it said, from what I've heard and read, this virus stays active and alive for 3 hours in the air. If this is so, how does social distancing help? We definitely walk through the air of an infected person during that time frame.
Yeah, so this is a question I have been getting a lot. There was a recent article that came out in the New England Journal of Medicine that looked at the stability of the virus on various surfaces as well as in the air. And so what they found was that, yes, in fact, the virus can hang out in the air when aerosolized for 3 hours. But something I want to point out, and the lead author on it actually tweeted this, and I thought this was really nice. She wanted to point out the point that these were experimentally generated aerosols, and they kept them afloat in a container, and that this is not necessarily evidence of aerosol transmission. So while yes, it's possible in the lab, that doesn't mean it's going to happen in real life.
It's definitely a lot less likely in outside too.
Well, I mean, it's like
you have wind and stuff moving it around. Yes.
It's not like you're going to cough in like a still environment. It's just going to linger.
But yeah, if you're in a grocery store aisle and somebody coughs in the air and you walk through it, obviously like that, you are susceptible to getting that. It's like,
yes.
But if somebody coughs in an aisle and then 3 hours later you're at 2 hours and 59 minutes and you walk through, you're probably okay, unless you pick up one of those items depending on what the surface is, whether it's cardboard or how, I guess copper. You want to wear a copper suit walking around, you'll be the safest, right?
That's pretty crazy. So
only paying pennies. That's what I always say.
Only pennies.
So that's a great answer there. So let's see. What's the latest on how long the virus will survive on surfaces?
Yeah, so again, these results are still pretty new. It comes from the same paper. I read through the paper, and I think their results are good. I think it's good science. And so what they found was 4 hours on copper, 24 hours on cardboard, 72 hours on plastic, and then between 48 and 72 hours on stainless steel.
But also there's like a half-life in those, right? Like they're at certain hours they are like the particles aren't as effective, right?
Right. So those hours are until there is absolutely no virus on that surface. And so one thing you have to think about is how much virus do you actually need to touch, and then touch, your eyes, nose, or mouth to actually get infected. And so, by 4 hours, 24 hours, or right before that, it's probably low enough that you're not going to infect yourself. But I would err on the side of caution and just clean the surfaces regularly. That's part of why grocery stores are closing down overnight. It's not just to restock, but it's also so they can clean, so they can get those surfaces good and clean.
So I know there's a story that came out recently that I think like 6 Amazon warehouses or 6 employees from Amazon tested positive. Do you think that is because of like the longer life on cardboard, and the majority of these package handlers, UPS and stuff, are managing cardboard boxes coming from all around the world? I mean, do you think that's something that maybe even should be looked at, considering, you said 24 hours is like the longest, I don't know, does it seem like
well, it's tough because those people could have been going out to bars the couple nights before. It's tough to say, like, because they work for Amazon, they got it working for Amazon. You don't know. You have to know the rest of their life and everything that they had done, 2 weeks to a month prior to that.
But also, I'm just saying, like, the packages that they're handling are normally cardboard boxes and stuff like that are being moved around the country. And if cardboard boxes are holding the virus longer than, most other surfaces, I'm saying, isn't that kind of a risk to the nation to be moving around packages and stuff like throughout the Amazon, distribution network? I don't know. That's all I'm saying.
Yeah, so it's a possibility. I wouldn't.
It's unlikely.
Call it the highest likelihood means of transfer. What's most likely, and everybody, I give these hours from this report, and I know everybody's gonna be like, I need to clean everything, I'm not touching everything. The most likely source of transmission is, somebody's gonna cough near you, they're gonna touch something, and right away you're gonna touch it, pick it up, and then touch your eyes, nose, mouth.
Gross.
And that's how you're gonna get it. And so that's why, we're all talking about hand washing.
That's how you get influenza too. Like, it's not like new science. It's
right.
Like you
want to make sure
you get sick.
Wash your
that's how you got it.
So.
Yeah, for sure. Well, all right. Well, that makes a lot of sense.
Ryan's household is sick nonstop. like every other weekend. Like, we sick again.
All right. Let's go to the next question. I like this one as well. So there's been a lot of talk about, it says, is it true the virus can't survive in hot weather? There's a lot of talk that, it's going to get warm, it's going to burn out.
There's hot weather, and then there's Houston. Those are 2 different things.
What did he say?
So there's hot weather, and then there's Houston. Those are 2 different things.
Humid hot weather. It's even better. So what do you think?
Yeah, so I hate to say it, but again, we don't really know. The answer is maybe. Maybe it'll go away in the summer. Maybe it'll just be lower. I'm looking at the Johns Hopkins map right now, and I see cases everywhere from Alaska to Mexico to Brazil, throughout Africa. The entire globe has cases popping up. So I don't know if weather's really going to have a role to play. The big thing here is that as long as the virus has a suitable host, it's going to continue to be able to spread.
Well, I would imagine, too, that, the hot weather would make it worse on those that are affected.
Why is that?
Well, I just know how miserable it is to be in the summer heat of Texas, and to have a flu on top of that sounds ultra miserable to me. A super flu. Like I would want to just die. So.
All right. Zach, you want to take some questions?
Yeah. So let's see.
D.
So what methods are epidemiologists using to estimate how long these pandemics will last? And which estimate do you agree with? And I've heard rumors about the time we'll be stuck at home ranging from 2 weeks to 18 months.
Yeah, so I'm not an expert on modeling methods, so I'm not going to try to hit on that. But from what I've...
Markov model.
Sure. From what I've seen, a lot of the data's been looking at other countries and making predictions off that. So, looking at China, looking at Wuhan specifically with their shutdown. There have been a lot of reports talking about South Korea that did all of that testing. And so that's what's been used to generate the models that I've seen and the predictions. Personally, I said this before, I don't think 2 weeks is going to be enough. But the idea of 18 months is really daunting.
Oh man, that'd be tough.
And I don't know if people would actually follow these guidelines for that long. I don't think so either.
Yeah. I know. I've heard that it could affect businesses for sure up to like 5 years.
Absolutely.
5 years from now.
So that's the big thing is, trying to weigh the economics and the health and people's sanity. Like there are so many factors involved.
Yeah, like how many people would die because of starvation because they don't have no money to feed.
I wanted to ask you a question kind of in relation to, like you said, like they're using samples from Italy, from China, but those communities and cultures are vastly different than how we live our lives from day to day in America. Like their version of community spread is going out to the market where 8 gazillion of them are walking around this close to each other, moving along. And then New York is similar to that. Whereas like New York City, at least, where people are just bustling along, using the subways, mass transit. So how are they, what are they taking into account? Whereas data from China might be this bad versus Italy versus Spain versus America, because all 4 of us as countries are completely different.
Well, you just said too, Houston, and you can't even just say America because Houston and New York are completely different. So
right,
Houston's spread out. New York's real condensed. Seattle, same thing. Where you're seeing a lot of it is they basically build up, not out. So it's like Seattle, New York City. A lot of those big industrial areas or those big city areas are just so condensed with people. Whereas us in Houston, we're really drawn out. So I'm just saying, like that. It's hard to. That's why.
Yeah.
I'm kind of interested.
So the way they're looking at it is, how much spread, how many cases show up after certain public health policies get implemented. So, after we do a forced quarantine, how long does it take for all of the cases to dissipate?
That makes sense. But see, what sucks is, like, I went out today to go to the store to pick up some things. And it's like just a busy, normal Wednesday, it looks like out there. It doesn't seem like people are even, like there, and yesterday, it was more than yesterday. It seems like there's more people every time I go out and about, like I'm sitting in traffic. So it's like,
what are you doing out and about?
I had to go to the grocery store and pick my groceries up. But yeah, it's just seeing all these cars.
Stay home, Ryan. Stay home.
What'd you say?
I said stay home, Ryan.
I'm trying my best. I really am.
I agree. Stay home.
I was trying to go play basketball, started an underground fight club. Corey wouldn't let me.
I saw that on Instagram too. You playing basketball. I was like, what the hell is he doing? You're like, I don't get this whole quarantine thing. I think you're supposed to play with randos on the street. Like,
well, I'm getting it now. So look, I'm on board with social distancing measures. I'm just trying to give my wife a break. She's stuck with me all day. So, we're just trying to work it out the best we can.
Okay, so also, what can people do to help besides social distancing? Dispel some of the myths about homemade masks, etc. What would be super helpful?
Yeah, so right now, social distancing, I'll say it again, physical distancing, that is the biggest thing.
Should we hashtag that to make it trend?
Physical distancing?
Yeah, should we hashtag it?
I think it already is on Twitter.
Okay.
Keep it going. That's the biggest thing that we can all do right now as individuals. There's no vaccine right now. There are no proven therapeutics. There are a lot in testing, but nothing's been proven. And so really it is physical distancing. And, for other respiratory disease outbreaks, this has worked. And so that's kind of what we got to stick with.
Yeah.
So we're getting, we're already a good 40 minutes in, so I want to pick through a few more of these for you, Corri, and then you don't want to hold you up too long because we want to talk jiu-jitsu for a few minutes. And as much as I know you love jiu-jitsu, I'm sure you don't want to talk about sport jiu-jitsu. So let me see. There's one here that's really interesting. It's talking about, there's been some stories in the news about people recovering from coronavirus, but then also getting it shortly after. I don't know if that's myth or what, but the question is if someone contracts the virus and their immune system overcomes it, could they expect it to be immune to that strain, or would there be a risk of being attacked by the virus again if re-exposed?
So you're asking me all the maybe questions.
Well, people like speculation. Come on now.
I know.
That would mean there's a different strain then, right?
So the official answer is maybe. And we don't have data right now to support either direction. But there was a recent study that came out using a non-human primate model that suggested we would in fact produce antibodies that would be protective later on. So that's good news. The big question is how long is that going to last? So you guys remember SARS back in 2003? Similar
SARS
story.
Everybody had one, yeah.
Yeah, so their antibodies lasted for quite a bit of time, about 8 to 10 years. And so, if that's the case here, that would be great. But there's another related coronavirus, MERS, Middle Eastern Respiratory Syndrome. And so the antibodies for that really only last 1 to 2 years, which wouldn't be so great. So the short answer is, at least for the short term, you're probably going to be protected. For the long term, we just don't know. I can tell you that there are labs across the country that are actively investigating this. And there are probably, if not already, there will probably be trials asking for blood samples from people who have recovered so that we can look and see, if these antibodies are still there and if they are protective long term.
Yeah, that's interesting.
Is one of the reasons why it's so not why it's so contagious, or why it's spreading so much, is that maybe because the fatality rate is actually lower than, like, let's say Ebola, where if you get it, you die. This, you get it, you are actually still walking around, spreading around. So having a lower fatality rate could actually make it a lot worse. What do you think about that?
Yeah, so that's kind of exactly the situation we're dealing with right now. About 80% of the cases are mild to moderate. That doesn't mean that you're feeling well enough to go out necessarily. You might still feel pretty sick, but you don't feel bad enough to go to the hospital. You don't necessarily feel bad enough to stay in your bed for 3 days. You're like, right. I really need groceries. I'm going to go out and get them. Or, I'll just take my kid to the park and cough on this bench and talk to my neighbor.
That's another thing. Don't let your kids go on the playscapes, because guess what? It stays on surfaces. So if you're letting them go on all of the plastic playscapes where other kids you are introducing risk to your kids.
And not only to your kids, but to yourself as well.
To yourself as well, yes.
You're going to go pick up your kid.
Yeah, I mean, for 2 weeks now, we've had to.
Granny.
For 2 weeks now, we've had to like try to explain to my son why he can't go to the playscapes. He's like, why not? You know, he doesn't understand. But I still see a lot of parents letting their kids on these public playscapes. Like, go to the public park, just don't let them play on those because kids are coughing all over them. And as we've talked about with it staying on surfaces, that's plastic, that's metal, that's all that stuff that can stay on there.
Yep.
Yeah, and this kind of segues real well into the next question. So it's saying many people are talking about having had similar symptoms in the past months, have tested negative for strep, flu A, flu B. Most feel that it is possible that they may have already had it. Me included. I was sick for like a week, and I felt like I was dying, and it was like basically all the symptoms that they had. Is it possible that, you know, just since there's not much testing and that we don't really know the length of the spread, that a lot of us may have already had it and recovered from it?
Yeah, so it's entirely possible. You know, we first heard about this in early January. It was first recognized the end of December, which means people were sick or picked it up a couple weeks before that. And, you know, China didn't do their lockdown until the end of January. And so there's a lot of travel that happened then. There was still travel that happened afterwards. And so, yeah, it's entirely possible that people have gotten this and we just weren't testing or they didn't know. That being said, assume that you have not been infected until you have a positive test to tell you otherwise.
I heard
you could have had flu.
Everyone needs to change their perspective. You need to act as if you do currently have it and you're trying not to spread it to other people rather than you're trying not to get it.
Okay, that too.
Yeah.
Whichever works for you.
I saw a meme that said that, and I was like, that really hit home.
Right. So that's why Ryan's going to play basketball. He's like, okay, I can get all these guys infected.
You know, there's two ways to think about it. There's the selfish way of I don't want to get sick, so I'm going to stay away.
Yeah, that could help for people too.
People are going to get me sick, and then there's the selfless of you don't want to get anyone else sick.
Yeah.
Man, that's awesome. Well, all right, well, Corey, we can start trying to wrap this up. I'm just going to ask you a question that all the jiu-jitsu people in the world are wanting to know.
When can we do jits again?
when can we get our jits on? Come on.
I don't know. It's hard for me too. You guys know.
Hey, you have a brown belt at your house.
I do have that. But I don't get to roll.
It's like, what are you talking about?
Yeah, he doesn't play any nicer with me than he does with you guys. I get beat up just as bad.
But you know what? He's such a gentleman about it when he doesn't do it.
Yeah, we did talk about domestic abuse going up, so maybe, you know, hiding it under the jiu-jitsu. Still got to go to the hospital. My arm's broken.
Yeah, I mean, I think it's gonna be a little while, and that really sucks. And I know it's hard, but Ben and I were talking about this, and Ryan, I'm talking to you and everyone else, but you too, Ryan. Get your cardio in.
Why do you always gotta bring the cardio in?
You're the one that always complains about your cardio. You literally say, my cardio is what got me.
You know, everybody says, oh, I don't have time to cross train. You know, I only have this hour time for jiu-jitsu, and fine. But
now you have more time than ever.
To cross train.
All those injuries.
I got into jiu-jitsu because I hated doing everything else physical.
All those injuries.
Jiu-jitsu, you only know lift weights. That's how I got 300 something pounds. Is I hated doing this. Like, go do it now? No.
Yes, do it now.
But yeah, Corey, thanks. You've been a great guest. Anything you want to say? Any other tips for the jiu-jitsu faithful, and or anything else to tie it up?
Yeah, you know, I miss everybody that I train with, and we'll be back out there soon. But for now, you know, we need to stay healthy, stay physically distanced, go for a walk, go for a run, but keep your distance from anybody that you're not normally around. we'll be back on the map soon enough. And hopefully everybody will be in super good cardio shape, and we'll also have a lot more muscles from lifting random stuff around our house.
Yeah, that's awesome. So thanks for joining us, Corey. We appreciate it.
Yeah, thanks.
Definitely be reaching out to you as this thing continues to move on. Appreciate
Awesome. Thanks for having me.
Peace.
Bye.
All right. So, we're here. Just back. Is it still recording?
Yeah, 1 second.
That was really good.
You like, just the top of your face is showing. Oh.
Well, please.
No, don't change anything. Don't change anything. All right, we're good to go.
All right, so we just had Corri, man. That was a great guest, man. Like she's designed on a lot of advice. Throughout this thing, she was, somebody that's really helped me kind of helped us as a business, really make the decisions we made. And her and her husband are probably two of the smartest people I know. So when they talk, I usually listen.
Like a smart scientist, I don't feel any better or worse about coronavirus. So.
Yeah, but it was still great. It was great information. It was real information, and it's not something that you're going to read on your something your grandma. Excuse me, I'm going through puberty, but nothing your grandma shared off of Facebook. But yeah, I guess we'll get into a little bit of jiu-jitsu talk. It's kind of the coronavirus and future grappling events.
Or lack of jiu-jitsu.
Yeah, lack of jiu-jitsu. So, I've been really starting to get into one podcast that Flow Grappling is doing. And dude, they've had some amazing some guests, and they bring in and they have the guests on there, and then they bring up old matches and have them all talk about it, break them down. So kudos to those guys for keeping the content rolling and adapting and still finding ways to keep us entertained.
Did you watch that Daisy Fresh stuff yet?
Oh, dude, the guy Andrew Wiltsey, I tried to have him step in last minute to find I forgot who it was. I think it was Lucas, to jump in last minute to find Lucas. And, he was like, man, I'm kind of injured, but I love you guys.
Yeah, I wonder why those guys are injured. Holy shit. They go, that seems like my kind of gym, actually.
Yeah, they said he was killing it. It's a purple and a brown belt, and then, he just started getting injured, over and over and over again because of how they train. And, black belt is finally healed. He's trying to get back into it, but man, I told Michael Sears, when it first came out, that was an incredible documentary.
Yeah, that was really super cool.
So, but yeah, I guess what's going on lately in grappling, me and Zach have been kind of, doing our best Mike Tyson, ducking and dodging, trying to, to move forward in this, the wild west that is pro grappling events. But, there's been some big news lately, I think hopefully, given the climate and if things can turn out all right, we're looking to make a return May 16th. But if we do make that return, we're going to be making the return in a restructured, kind of revamped, and kind of geared up for a great rest of 2020, but also a profitable 2020. Because the days of us going out there and doing what we were doing are over, and it's going to have to reflect the current climate we're living in. We're going to have to weigh into the fact that some people might not want to be coming out as much. We have to weigh in a lot of other things. People traveling.
Yeah, people being able to afford to come to events because they've been out of a job for how long and just can't spend the extra cash they have on going to a grappling event. So we're gonna have to take all that into account for what kind of promotion we put forward for the next half a year to a year.
Yeah, it's definitely going to be challenging. I've actually spoke with our venue, our buyer at Warehouse Live to kind of flesh out dates and see what. And I just told them, I'm like, hey, maybe these dates, maybe this, maybe we keep this. I told them I want to give it the next week or two, at least on April 1, to see where the world's at and to see what the outlook looks like before. Because if we go in mid-April, start promoting the event, then it's just 4 weeks. I wouldn't even really feel comfortable starting to plan an event until people are at least back training. And who knows when that's going to be.
Yeah.
So,
that makes sense. What do you think of the kind of the other grappling promotions? How long do you think it's going to be before they start kicking some things back up?
Well, Polaris, they were trying to be, those British guys, that article thing that came out that one day, they're, oh, you guys, if you're just going to make it a Texas-only event, why don't you just cancel it altogether? It's a money grab, yada, yada, yada. Well, they're like affiliated with those guys. It looks like Polaris was going to try and go on spectator list, kind of like Submission Underground did with, they're coming up this weekend in Oregon, and the UFC events have. So I think that's kind of like a moratorium with those guys to try and find ways to still make the show go on. But in the UK, they just basically locked down the whole country. So I think that Polaris is about to be in the same situation we were, with having to scratch their events for the foreseeable future. And I'd be really surprised if they were able to pull off that Submission Underground event in Oregon, if it was to happen, considering the proximity to Seattle. So, I mean, those are the only two events really out there trying to do anything right now. But outside of that, I think coming out of it, it's going to be us. It's going to be Submission Underground. I think, Fight to Win, of course. There's rumors that Kasai might not be doing to that grade, or be taking. I don't know. There's just rumors going around that maybe they're not going to come out of this.
Rumors, Ryan, are trying to start. No, I'm sure.
Not trying to start anything. I'm just saying, like, there's just some stuff going on that, in the industry, it's making people second guessing. I mean, that's second guessing. After all the bullshit we had to listen to over making a decision that we made, that was a really well informed decision. But it came out. We saw people's true colors, and no hard feelings. We stayed above it, and we're just going to move on and keep putting on great shows and keep doing what we do. That's all we can do, right? I mean, we're going to come out of this a lot smarter, a lot wiser, but also with a renewed outlook on what the future is going to look like.
So what do you think about one of our? So we have our unique events like the Grappling Royale, the tag team. What do you think about inanimate object grappling? With how much people have been, because what people have been training is training on their furniture, so we can bring out a couch, see how you can take down a couch.
Why do you got to do this to my brain every time we start talking? It always starts. Could you imagine?
The only thing I've grappled in 3 weeks is a chair.
Could you imagine? You put a rubber knife hanging from a rope right in the middle of the mat. All you can do is get a chair and jump and grab it.
Professor Brandon's always been talking about a street clothes match, right? He's always wanted to see it. And guess what Keenan does? He does a street. Right. Yeah. So there may be something there. I mean, maybe just like tracksuits. Tracksuits and hoodies.
Have people wear something like they'd be wearing to work, like a full suit, tie, stuff like that. I mean, because the tie, you can, I don't know. I'd like to see it.
Not that many people wear ties to work, but.
But no, I mean, all those unique matches, I mean, as long as nobody does them first, which in this industry you never know. But yeah, the Grapple Royale, when we come back, that's happening. I mean, the 10 guys are still raring to go.
You know what we should do though? If we do like street clothes, let's do like the military, like Air Force in their uniform against the Marines in their uniform. And like have like a 4-way like military tournament between Air Force, Army, Marines, and Navy.
So like the Air Force would wear a dress, the Navy would wear like lingerie, the Marines would just wear a big dunce hat, and the Army guys would come out looking like savages. I think that's a good.
I think that works. That works for me.
But no, with everything going on, man, it's just I think the future of grappling is just going to really hedge on, who's willing to get out there in this climate and still try to do something. And I know I'm committed to doing it. I know you are, and I know we still got a lot of ideas and a lot of things that we haven't really been able to put in motion yet. That I think are not only going to just help us with our bottom line and help us continue to try and make a profitable or sustainable event, but it's gonna take grappling to the masses. Can you imagine when we finally bust off a live Royal Rumble? Like, dude.
I was excited to do it this month.
Yeah, it's going to go everywhere. Like, it's literally going to be a viral event, especially if it goes off as crazy as we think that it's going to go. I mean, the Andrew Tackett Challenge, he still wants to do that match. He's still wanting to come out and do that. So, I mean, look, the coronavirus happened. We didn't, have a brain aneurysm. We're still the same creative, innovative guys we are. We went through a little flack after we made our decision to cancel 3CG4. But I mean, you can turn on the news and just see that we were right. I mean, there's nothing more to say about it anymore.
NBA got flack too. Everyone got flack. We don't even need to talk about getting flack anymore because it was a small amount of people, and it doesn't matter.
Yeah, it doesn't matter anymore. You're right. And then lately there's been people that have been coming out like these little I mean, the worst thing that happened during the pandemic is that every grappler stopped training and wanted to start a podcast.
Oh, yeah.
like everybody thinks, well, I'm either going to grapple with my furniture or I'm going to start a podcast and start talking unintelligently about stuff that doesn't even matter.
I did see a meme that was like, no, it's like Instagram Live is not a good time just for you to try out Instagram Live or something like that.
So everybody's doing like these podcasts and like doing these and doing all this stuff, and like in that you get some of these people that shouldn't even have a microphone in front of them that speak on our business, and they speak on fighter pay, and they speak on this, and they speak on matchmaking. What people don't realize is that with Third Coast Grappling and Zach are trusted us. We've had people that have come along in our community that's helped us, that have backed us, that have done things, and we have people that work with us, work for us, that are extremely bright as well. But what it comes down to is that this whole thing, from the matchmaking to the marketing to the video content creation, we don't just say, hey, go take care of this. Like, me and Zach are very, 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 very involved day to day. And even more so, Zach still has his day job, where I'm kind of stuck in it. So it's like when people go out and they say, oh, they're not knowing how to matchmake and they're just doing that or they're doing this and people aren't doing it right. I'm like, they do not realize that every match that we have put together at Third Coast Grappling comes with a storyline. Because like what I can put Jabroni 1 versus Jabroni 2 all day out, on the mats and have them go, but nobody's going to care. It's probably going to end up a bad match. And we go home about it. I think what makes a good matchmaker and what makes us unique is we put the time and the effort into trying to make stylistic matches and get rid of all of like the way it was mentality. No, you can't put a black belt with a brown belt, or you can't put a blue belt with a brown belt. That's you go crazy. You wouldn't want that. Like, we've just kind of blown up, what the expectations that people have had for grappling events, and it's rubbed some people the wrong way. But at the other end, we've done more in our year as a business than any other grappling promotion ever has, I think, in the industry. So we're onto something. So for people to come out and, they try to slate us for this, oh, you guys are poor, you can't pay your fighters, oh, you guys are this, or you guys are that. It's just all nonsense at the end of the day, because, I mean, it's just, when it comes back to these podcasts and these people talking, go grapple with a chair. Go, spend time with your family. Don't spend your time talking shit about people in a business that you literally have no idea about. If you want to talk about something, talk about how you can help the industry, what you're going to do after this blows over. And if you have all these great ideas about how to change the grappling industry, then go do them. And that's kind of my rant on that. This has kind of been a response to, some people that have been on a couple of podcasts lately that have been talking some stuff towards us. So I just wanted to get that out there and get my Ryan's Rant unofficial segment out of there. And here we are.
I even put the Ryan rants up during that. So.
Did you really?
Yeah.
I think we should probably just edit that part out because I kind of got off on it.
No.
Nah, just keep it.
All right, with that, everybody stay safe, wash your hands, especially, I guess just wash your hands. Do cardio.
Wash your hands, hang out with your family, be a good person, and when this is over, make sure to come see a Third Coast Grappling show.
How cool would it be to come out of this stronger and like better in shape and less injuries? You'd be a fucking animal if you go back to your jiu-jitsu gym and now you're stronger and have better cardio. So
I'm just gonna gas like everybody else and use it as an excuse. I'm gonna use the coronavirus. See, if I'm gonna use the coronavirus as an excuse, I'm gonna use it as an excuse for me being a fat ass and my cardio is terrible when I go back to jiu-jitsu. So let's just write that down.
All right. All right, everybody. See you later. Have a good night. Peace.
Peace.